Hi, everyone. Welcome to the eClaims webinar, Submitting Claims for Virtual Services with eClaims. My name is Camille, and I work in marketing for the eClaims service. With me today are my colleagues, Vanessa Herschel, a Senior Product Manager for eClaims, and Michelle Charbonneau, our eClaims Account Executive. I want to start this webinar by saying that due to the current situation with COVID-19, our team is working remotely, and that's why we're recording this webinar from our homes. We know that it's a difficult time for everyone right now, and we really hope that by recording and sharing this webinar, more healthcare professionals will be able to watch it and have access to the information on demand. So for today's webinar, we'll first have a quick overview of what eClaims is, and then we'll spend a good portion of the webinar explaining how to submit virtual claims. We will then answer some of the most frequently asked questions we received, and finally, we'll share resources that can help you after you watch this webinar. So we'll get right into it, and I'll pass the mic over to Michelle to present eClaims.
Hello. So if you're watching this and you are not exactly sure what or how eClaim works, I'll take a moment to quickly go through it before we go into today's main topic, submitting claim for virtual services. So, what is eClaim? eClaim lets you do direct billing on behalf of your patient client. You'll see throughout the presentation, I will interchange patient and client. It means the same thing. The statements are used by many professionals, but it means the same thing. eClaim works with 85% of all Canadians that own a private insurance plan. eClaim access is totally free through our TELUS portal. You can register at telushealth.com/eClaims. How can eClaims help your practice right now? As a healthcare professional, here is how eClaim can help you beyond virtual care. There's 3 points I would like to discuss. The first one is the reduction of credit card fee. Virtual care consultation is obviously better used if payout is made by credit card. But did you know that when you are using eClaims, you are reducing your credit card fees? A very good example of this is if you would be charging for a service that totals the amount of $100 and your client pays $100 with their credit card fee, you would be paying 2.5% of that $100. But if you are using eClaim and process that $100 through the eClaim through your patient's insurance plan and notice that he's covered at 80%, well, all of a sudden now you're only paying 2.5% of credit card fee out of the $20 out of pocket, since the insurance company will pay you directly the $80. So a lot of savings for you, and in the long term, very beneficial. The second point is better access for your patient. So you can encourage your patient to feel free and comfortable to get virtual care consultation. And obviously, with the out-of-pocket expenses, it really helps in these challenging financial situations. On the last point, more business and customer loyalty. Many clients and patients are challenged with their income, as I was just saying. Nonetheless, your client still needs to consult you virtually, so it's a good way to keep track of your clients and make sure that you're putting their health first. Participating insurers is very important on eClaim. So eClaim will be as successful as long as the insurers are behind it to do all of the adjudication. Most of all the insurers that you see here will cover virtual care in the limit of the service that is being rendered. Vanessa will allude to it in the main presentation. Also remember to take in consideration that all claim responses is based on the coverage plan of your patient. What I mean to say here is that you have to consider, for example, that if ever a claim is rejected, it might be due to the plan of the patient and not the fact that you render it virtually. Also, eClaim is available through are leading practice management software. So if you are using one of these management software, eClaim is integrated in there. I encourage you to reach these software vendors and get the detail to get access. You still need to register on an eClaim portal. So remember, telushealth.com/eClaims to register, and then you will have access to eClaim through this management software, eliminating the double entry of information. All right. And now for the main topic of our presentation. We have all waken up just a few weeks ago to this coronavirus, and now realizing that this could go on for a while. Absolutely no doubt this pandemic has significant impact on you as well as on your patient clients. So without further ado, we will be expanding on the boundaries of virtual care with eClaims. Vanessa?
Hi, everyone. So again, as my colleagues introduced me, I'm Vanessa Herschel, and I'm the product manager for eClaims. So today I'm going to be talking to you about how you can be submitting claims for services rendered virtually through eClaims. So to get organized for this topic, we've been speaking both to the insurers as well as to the colleges to understand what their position is with regards to extended healthcare services being rendered virtually. So today I'm going to talk to you about what their positions are, at least the ones that we know for now, how you can use eClaims to submit claims for those services, and then also answer some of the most frequently asked questions that we've received from providers about submitting claims. So as you can imagine, the position on virtual services has been changing quickly. Some of the colleges have implemented temporary guidelines. Some insurers are also temporarily accepting claims for services. So just keep in mind that this is an evolving situation, that it is likely to continue to change during the COVID pandemic as well as after it's done. So we'll do our best in terms of keeping you up to date with the most recent information from the multiple parties involved in eClaims. Let's start with the definition. So there's different terms being used out there by the colleges, by the insurers, and ourselves. So some of the terms are telepractice, telehealth, virtual consults, virtual services, digital services. In general, we're going to use these terms interchangeably, and they mean the same thing. The key definition is that it's a service that is rendered at a distance where the patient and the healthcare provider are not in the same location. Different technologies can be used to render these services. They may include the phone, it may include video conferencing, they may include some video conferencing apps. So different technologies out there, and make sure to look at the different definitions provided by your governing body to make sure that you are practicing it correctly. Okay, so when we look at submitting claims for virtual services, and if you're considering rendering virtual services, the first thing and most important thing that you need to remember is to follow the guidelines from your regulating body. So number one recommendation, go to your college, go to your regulating body, and understand what are the standards of practice and the guidelines that they are providing in terms of giving a virtual service. Most of them have already posted these guidelines. Some of these guidelines have been there for a few years in the case of certain professions. But in terms of other professions, the colleges have been updating their sites and publicly posting the guidelines, best practices for telepractice. So make sure to look at those and follow their rules and regulations in detail. In general, the same rules apply as if you were rendering the service in person. So the colleges and the regulating bodies, obviously as yourself as well as the providers, the interest of providing the best quality of care for your patient is the most important, and this should be regardless as to what or how you're rendering that service, whether it's in person or it's at a distance. Also important to note is that by looking at those guidelines, most of them have additional steps that the providers need to take when they're rendering the services virtually. So, for example, and just in general, these additional steps are mostly to protect the patient's privacy and making sure that you have the information stored securely in a way that others can't reach the private patient information. So on the next slide, we're going to look at some examples of the frequent guidelines that we've seen across the different college guidelines and different practices. So obviously, you need to look at what types of services can be rendered virtually. Most of the colleges have indications as to what types of services. There are some services, for example, which are quite obvious, for example, manipulation that cannot be done virtually, but others such as training at a distance or education that are mentioned as being able to be rendered virtually. So take a look at what your colleges are stating. Most of them do have indications of the types of services that can be done at a distance. Also, it's frequent to see across the different professions that there are mentions about keeping the patient's health information safe, and those include having or using tools that are PIPEDA approved. And this is all PIPEDA is with regards to the privacy of the health information for your patients. Also, common to see across the different guidelines that you need to make sure that both your setting as a provider, as a healthcare provider, and the patient setting is safe, secure, and confidential. So make sure that when you're providing your healthcare service, there's no member of your family, for example, in this COVID situation, that can hear and have access to information that is private for that patient, and same goes on the patient's side. Additionally, in terms of the technology, there's always mentions of considerations of the technology that your patient is able to use. So before rendering the service, making sure that your patient is going to be able to use the technology that you're proposing and that they have the right setup, for example, access to smart devices on their end in order to receive that virtual session. It's common to see as well that you need to have patient consent, that they agree to receive the services virtually, and that you need to explain what are some of the risks that may be involved with the virtual service that are not there in person, and most of them, again, are about the privacy of their information. Finally, there's another point that is common across various colleges. I did see some exceptions. For example, and that is that having an existing relationship with the patient. So on the case of the physiotherapy, that this is not mentioned, but it is common to see across professions, for example, on the chiropractor. So the colleges have stated that an existing relationship needs to be there before being able to render the service virtually. So again, these are just examples of what is common across the different professions and different colleges, different provinces. Make sure to look at your own college, your own regulating body, and follow the guidelines and standards posted by them. Okay. So as I had mentioned, we've been working with the insurers, and we've been gathering their positions in terms of whether they will accept claims for services rendered virtually. So the insurers have been following the position from your regulating bodies, from the colleges mostly. And if the colleges are accepting claims or accepting services to be rendered virtually, most of the insurers are following those positions from the regulating bodies. The insurers in general, they're going to be looking at these claims submitting during this time, during the COVID-19 pandemic, They're going to be looking at those claims closely. It's a new time for insurers, for the plan sponsors, the employers who are the owners of these plan benefits. So they will be auditing the claims that are submitting at this time. So make sure that you have the patient consent for receiving the service virtually, as well as keeping in your patient records that the service was rendered virtually. Some insurers are going to be conducting audit at a later date just to make sure that everything is to the interest of the patient and their care. So if you experience any issues when you're submitting claims to the insurers that are participating on eClaims, make sure to contact them directly, as they're going to be the ones who are going to be able to respond if some claims were rejected and as to why. You can access the contact information for the insurers directly on the claims response page, and also you can access it on telushealth.com/eClaims resources. If we move to the next slide. Yes, so insurers are accepting claims for the services rendered virtually, and we have created a table where you can see all of the different insurers that are participating in eClaims and the different professions that are accepted on eClaims, and you'll see whether the insurer is accepting claims or not for that specific profession. So we're not showing this table right now today because it's an ever-changing table. We have positions that are changing, every day with some of the colleges making changes. So we'll make sure to keep on updating it as we receive some changes from the insurers and as the positions from the colleges change. All right, so let's move into how you can submit claims for virtual services on eClaims. In summary, you should continue to do the same process that you're doing today. So we have not added any additional fields where you can indicate that the service was rendered virtually. You should continue to just simply submit the same way that you're submitting today. You have to select your primary practice location as a servicing location. So where your practice is usually based, select that location, and just select the service code that best describes the service that you rendered. In the patient record and in the patient invoice, please make sure to document that the services were rendered virtually, and you'll be set for any potential audits that happen afterwards with the insurers. If we move to the next slide. Here we just wanted to ask you to make sure to select service codes that are likely to be rendered virtually. So here you have the examples of some of the service codes available today for chiropractors. In the green box, you have some examples of service codes that would make sense to be rendered at a distance, services to be rendered at a distance, which include, for example, training, instruction for self-directed exercises. And there's also examples of service codes that you should avoid during this time unless you're actually seeing the patient physically. So these include service codes for treatment or intervention. Anything that includes manual like manipulation should be avoided, as it definitely will raise some flags with the insurers. All right, so now let's move on to the frequently asked questions. So over the last couple of weeks, our call center has been receiving several questions from providers, and we've grouped them into the most common themes, and these are the ones that you're going to be seeing today, that we're going to be answering today. First question is, will eClaims have new service codes for virtual services? The answer here is no. We have not added new service codes for virtual services. you should simply select the service code that best describes the service that was rendered. Second question, should virtual care sessions cost the same as regular sessions? So some providers asking if the fee should be lower, whether insurers will be accepting claims that are at the same fee as if they were in person. Answer here is that providers should use their professional judgment with regards to the fees associated with that service. Insurers and TELUS are not recommending any changes to the fees. These should all be set by the providers. We do ask, though, that insurers ask that the patients, the plan members, are aware of the fees that are associated with the services if they are rendered virtually. The third question, will TELUS provide telepractice consent forms? So as I mentioned before, it is common that the colleges are asking for the patient consent for the services being rendered virtually. TELUS has not developed a template for you to use, but we've seen several colleges providing some templates, and we've added a link in our helpful links section of the webpage that you found this webinar. You'll see there are some suggested templates from some colleges that you can use. All right, another question is related to not necessarily to the virtual care, but to the pandemic. Today on eClaims, there's a 30-day window for providers to submit claims, and several providers have been asking if we will extend that 30-day window because some of the providers don't have the ability to go to their usual work location to retrieve some of the documentation and patient files in order to submit claims. So on this topic, TELUS has been communicating with the various insurers. The truth is that it's likely to involve technical changes from the insurers and from TELUS in order to change this parameter. And we are working with the insurers to see if this is possible, and we'll communicate with providers as soon as we have an answer. Another frequent question is with regards to referrals or prescriptions by physicians. So what if patients need updated doctor notes to be covered? Will this be exempted? Here, insurers are not likely to change their rules in terms of requiring a prescription or referral from the doctor. Most doctors are still rendering their services virtually, so same way as extended healthcare providers, they're transitioning to virtual sessions. So patients can continue to have these patient notes. We do know that there are a few insurers such as Sun Life who have communicated that they will exempt this requirement during COVID-19. We'll see as this situation evolves, but most insurers are not making changes. And finally, can providers submit eClaims for virtual visits through third-party practice management software, so the software vendors that are certified on eClaims? And the answer here is yes, you can continue to use the practice management software to submit eClaims, and there's no changes. You should follow the same guidelines as I've indicated today when you're submitting claims through your practice management software. All right, so that's it for our frequently asked questions. You are going to be able to access these on the web page. And if you have other questions, there's going to be a link on that web page as well, where you can send us your questions, and we'll do our best to answer it as quickly as possible. So now my colleague is going to walk you through some of the tools that we have made available to you.
Thanks, Vanessa. So that was a lot of information to take in, but we wanted to make sure that you could find all those resources online as well to help you out. So first of all, you can find this webinar recording on our special virtual services page that you can see at the link below. So that's telushealth.com/eClaims virtual services. So on that same page, you'll find this presentation, answers to FAQs, the list of insurers that Vanessa was mentioning earlier, as well as other helpful links. So that page really has all of the information that you need to know for submitting claims for virtual services. Then if you're looking for eClaims material, I'll invite you to visit our eClaims resources page. That's at the link below, so tellushealth.com/eClaims resources. So we keep everything in one place to help ease your experience. So on that page, you can find training videos, FAQs, and some other resources that we've created over the years based on the customer feedback that we have received. So that is all for today's webinar. First of all, thank you, Vanessa and Michelle, for your participation. And thank you also to everyone who submitted questions and comments for us to address in the webinar. So as Vanessa mentioned, if you have any questions about eClaims or around virtual services, please feel free to contact us. So you can click on the Contact Us button on the page that's listed below. So on the eClaims Virtual Services page, you'll see a little Contact Us button that's at the bottom of that page. So you can fill out the form, send us your question, and we'll make sure to get back to you. So we really hope that you found this presentation informative, and we wish you a good day. Thank you.